So you recently have acute low back pain. This could have happened with you trying to pick something heavy. You could have woken up in the morning and you have back pain. You could have literally been walking and now you have some irritation there. In this video, we want to create a series for you to address what to do in the acute stages of low back pain so that we can get you back to recovery and getting you moving as much and as quickly as we can. This series, first video here, we want to talk about the different stages or different types of low back pain that somebody could experience in the acute phase. And in the next series, we will be talking about the various exercises to do in the coming weeks. So let's break it down. The types of acute low back pain that you might be experiencing. There's really a few. One is it could be something wrong with your joints. This could be you've irritated the joint. This could be a form of arthritis that you might be dealing with that's recently flared up. Again, you could have picked something up and now you have an irritation within that joint. A second type can be muscular in nature. Muscular, same thing. You've strained it. You try to pick something heavy. You try to make an awkward movement. Maybe you weren't very active and all of a sudden you decide to participate in some heavy sports and now you've irritated or injured the muscle. The third thing that this could be is discogenic in nature. Now, if it's discogenic in nature, usually you're somebody who's between the ages of 20 to 40 years old. Again, you've probably picked something up heavy, you maybe did a movement that you're unaware of, and now you're getting this pattern of pain. Let's break down each of those specific types of irritations and talk to you a little bit about the symptoms you might be experiencing. If your acute low back pain is due to a joint-related issue, typically you're going to experience pain with kind of whatever movement that you do. It hurts you if you try to bend. It hurts you if you try to extend. It's hurting you when that joint is being irritated. A quick little test that you can do to see which side or which joint is irritated: bend forward, place your hand on your thigh, bend forward in one direction, place your hand on the back of your thigh and bend backwards, and see, comparing to the other side, do it on this side as well, and see if one side hurts more than the other. If you do find that, that'll tell you which side of that joint is irritated the most. So in general, with joint irritation, you're going to have pain kind of with whatever type of movement you do. The key thing to remember is that the pain tends to be localized. Often patients will say it hurts me kind of going across my back. You often don't get irritation or pain going down the leg. That is more of a discogenic thing, which we'll talk about in a bit. The second type of back pain that you could have is the muscle strain. Typically with a muscle strain, it hurts you when you do a specific movement. For example, you might not necessarily have pain if you're trying to bend over or pick something. You might only get pain if you're trying to reach for something or twist or rotate. It hurts you with a specific movement. And so the quicker you realize which movements are irritating you, stop doing those movements in the early stages so that your muscle and your body can recover. That will go a long way. Again, with muscle pain, you're often not going to get symptoms of, again, pain going down your legs or anything like that. However, it's important to note that if your muscle pain is quite bad, you know, scale of 0 to 10, 10 is, oh my God, this is the worst thing I've ever felt. 0 is I don't feel it at all. And you're like an 8 or 9, you might experience spasms. And spasms are really where your body and your lower back senses that there's something going on, something wrong with that tissue or that muscle. And it causes all the surrounding tissue just to seize up because it's trying to protect the area. And so if you're experiencing that, that could again be a muscle thing. But that's a scenario too where you do want to get further investigation to really wean it out. However, in general, muscle strains are usually indicated by, and it hurts you if you do specific movements, so watch out for that. The last type of low back pain we'll discuss is discogenic related type of pain. This is often where the disc itself is irritating the nerves, or the nerves itself could just be irritated, might not even need to be disc related. However, in these scenarios, typically you'll start to experience pain and discomfort actually going down the leg. It might even go down towards your feet. If you're experiencing a lot of the pain in the back of the leg, back of the thigh, this could be contributed to your sciatic nerve being irritated. If you find the symptoms and the pain is going in front of the leg, in front of the thigh going down, sometimes that's a femoral nerve being irritated, which is a bit higher up in the low back. Typically with this, you'll find that extension, leaning back, makes things feel slightly better. You'll notice that bending or twisting while you're bending, that's typically where things will get worse. You'll also notice that lying down, resting, you'll feel better. And activity, waking up first thing in the morning, those are the things that are going to hurt it the most. It's important not to discount your low back pain. It's important to assess and understand specific red flags that we look forward to. So although we want to really provide you with a basic form of exercises that you can do during this acute stage and really get you back to maximizing and optimizing your mobility, don't ignore these red flags. Certain red flags can be having issues with going to the washroom, bowel bladder movements, you're having too much urgency, you're not able to control it. The other thing that you want to be aware of is if you're starting to get symptoms going down both legs. If you feel symptoms going down both legs, that could mean that central cord is actually being irritated, and that could also be an emergency. Another really key thing to observe is having pain at night that's leading to night sweats, really bad irritations, or even if you're noticing you're getting a loss of appetite with such a pain, these are things you definitely want to go get checked out further and not ignore before starting our program. Now that we've discussed a generalized overview of acute low back pain, our next video, we are going to discuss what you should actually do within the 1 to 2 weeks of experiencing such pain so that we can get you back to moving and feeling better again.